Dr. Fordice, why don't I'm going to ask you a little bit of a question. We've been working together for I think for an extended amount of time. I think it's been about 20 years that we've been working with your dental practice. Tell us about the impact that we've made in you and your practice, and how we've helped you, kind of move your dental practice to the next level.
Well, I think, boy, this is a multifaceted question in the sense that um, this is kind of like asking, well, how does marriage benefit you, or something like that, you know? There's a lot of different answers.
There's a lot of answers
But,
for that one.
you know, the simplest way to maybe look at it would be to think before I had a consultant. I bring certain gifts to the table. I can fix teeth. I can do some of these things. There's some things that I just don't like to do and don't do well. And just like I have a staff that I need to be able to do all these different things in the dental office, I need somebody that's an outsider with inside knowledge to help me and my staff to have a broader perspective. I'm out here in Fairmont, and I'm kind of by myself, and I could delude myself into thinking that I've got it all together. But I think I need a team of people to be able to pull off the complexities of dentistry. And I don't like finances, and I don't like business administration. But I better have those things in place and do them well.
Correct.
And what's my perspective? In how do I understand that I'm doing it properly or not? And so what your consulting group has done for me is I know how I sit in respect to other dental practices in all these different areas. Secondly, if you're going to be successful, you have to have systems. Everybody has to be on the same page. Your staff, your patients, and you all have to be pulling in the same direction. And to have that, you have to have a system for scheduling. You have to have a system for planning. You have to have a system for how you are going to deliver the care, how you're going to communicate with your patients, how you're going to do their finances. All those things have to have systems. And so you guys have helped me to learn how to have those systems put in place. And then having an outsider come in, 3, 4 times a year with a topic or something related to dentistry. Um, a consultant can say things to the staff that coming from me would sound self-serving. So in other words, it's a place where in some ways you're cheerleaders, in some ways you're also able to say some things that are on the tougher side to say. Okay, this is how we need to do it because this is what works. But when you have a staff that instead of trying to keep patients out of the schedule are trying to keep the schedule full, trying to keep me from talking so that I can be productive. Uh, all those kinds of things. My staff is trying to make this place run efficiently.
Mm-hmm.
And I don't have them coming up and beat me over the head with questions and things all the time during the day. We just function as a team. We cover those questions, but we do that ahead of time. In other words, we figure out the system before we're even doing the dentistry, and then the rest of it flows.
Mm-hmm.
So I don't know, is there some other thing that you want to ask about?
I mean, I think the only other thing I would say is, of all the work that we've done together, what has been if you could boil it down to one thing, the greatest benefit of working with, White and Associates Practice Consulting, what has that been?
I think making the practice patient-centered, patient-friendly, making it where the relationship is king, and making the system so that the systems around dentistry so that that patient feels well cared for and special and treated well. That's the key to making a successful practice. And you guys are not just number crunchers. I think you understand that the bigger concept of the human side of dentistry. So I'd say that would be it.